Kiruthika Balasundaram. I'm a general non-invasive cardiologist. I've been practicing for about 2 years now. I did my residency and fellowship at this hospital, and I stayed on to work here because I really liked the environment here. My focus is outpatient cardiology. I have a big patient practice over here. I read echoes, which is part of my the non-invasive part of my job. And I work with the fellows here, so I'm involved in the training program as well. So I think one of the big challenges I feel like my patients face is struggles with their insurance companies, getting medications approved, getting tests approved, being able to put them especially on the medications that I think is right for them, and then having issues with high copays. So that's a big issue. Another big issue is definitely with electronic health records, trying to get records from other hospitals. The system we use now is a little better in that we get access to some records from certain hospitals, but not all. And so when I see a patient for the first time and they tell me they had just had a heart attack and massive workup done at a hospital in Florida, there's no way I can access those records right away. So that kind of makes a lot of the visit meaningless, because I basically have a blank slate, even though they've actually had all sorts of testing done. So that's a huge issue. If you're referring to things like expectation in terms of how we document things, I agree. I feel like we're expected to click certain buttons and to describe problems in such a way that we end up spending a lot of time on documentation, which is valuable time that we could be spending with the patient directly, or we end up doing that on our own time, which means that we end up staying up till midnight doing these things. I remember a time both my siblings are physicians, and we were talking at midnight, and we were all doing our charts at the same time. So, and that's a very normal scenario, unfortunately. One thing would definitely be having a universal health record system. I completely support that concept. I think it would make things so much easier, especially again when you see a new patient, or if you have a patient who was traveling somewhere and then ended up having a health issue and got hospitalized. Just having that instant access to those records when you see them makes a huge difference. Another thing would be if we could see less of a requirement in terms of the amount that we need to document. But I think that's more of a nuanced topic, because there are some benefits for sure to excessive documentation, because things don't get missed. So that's a frustration, but I don't think I have an answer to it just yet. I think it's a great concept, and I fully support it. I think it's only going to make things better, having access to all of the records easily. I think an important focus would be to make it ultimately free, because I think that's gonna eventually make it the most useful, because if you need to pay for it, then it's going to exclude some people, and that's not fair when it comes to health. It's not fair, I think, to have certain people with privileges who have the money to pay for certain things or afford certain types of insurances that will support it, and for some people to be excluded. So I think that's an important thing to remember.